Staying in contact. I'm London Mitchell. Today, a special program. We are going to listen to a news conference held this past week by Dr. Bruce Vanderhoff, Ohio's health director. Dr. Vanderhoff stressed the importance of vaccines and school health centers. First up, Dr. Vanderhoff has the most up-to-date information about vaccines. And that's especially important as we enter the respiratory virus season.
Now, fortunately, here in Ohio, right now we have low levels of RSV, flu, and COVID-19. But we know from past experience that as the weather changes and we're all inside more, it's inevitable that we will begin to see more viral activity. Now, typically, we experience an uptick that begins around Thanksgiving and then a peak around Christmas, followed by a second peak and usually larger toward the end of February. What this means for us right now is that this is a very good time to be thinking about getting a vaccine, whether for RSV, flu, or COVID-19. Now, I want to outline here the current recommendations for who should get these vaccines. First, starting with RSV, the CDC recommends vaccines for, first, anyone over 75 or those between 50 and 75 who may have an increased risk of severe RSV, including those with chronic heart and lung disease and those with weakened immune systems. Another group for whom the vaccine is recommended would be pregnant women in their 32nd to 36th week of pregnancy between September and January, so now. We have a very good vaccine available for them, or babies born between October and March whose mothers did not get the vaccine. They're eligible to receive an RSV antibody shot. Now, turning to the flu, the CDC says that an annual flu shot is recommended for anyone 6 months of age or older. For COVID-19, the CDC has emphasized shared decision-making while preserving the availability of the vaccine for all ages, including children who are eligible for the Vaccines for Children program. The recommendations from the FDA and CDC underline the fact that those age 65 and over are at particular risk, as well as those with a wide range of medical conditions that can increase your risk of contracting severe COVID-19. The CDC encourages you to have a conversation with your provider who can discuss your personal medical history and help with informed decisions. We know that many people go to pharmacies to receive vaccines, and it's important to note that under Ohio law, pharmacists, pharmacy interns, and pharmacy technicians are permitted to administer COVID-19 vaccines to any person 5 and up without a prescription. We do recommend that you call ahead to a pharmacy to ask about availability and any vaccine policies they may have. Of course, vaccines protect us from a wide range of serious illnesses, including measles. Sadly, we continue to see outbreaks of measles across the nation this year, and even here in Ohio, we had a cluster of cases not long ago in the greater Columbus area. The fact is that we continue to see too many people contracting illnesses that can have very serious health effects, whether it be measles or more commonly pertussis, which is also known as whooping cough, which can be particularly harmful to very young children and infants. For decades now, we have had very safe and very effective vaccines for serious diseases that include polio, tetanus, rotavirus, flu, pneumococcal disease, hepatitis, and many others. So I join countless healthcare providers in encouraging everyone to stay up to date on their vaccines. Now, I'd like to turn to our main topic today, which is school-based health centers. These are just what they sound like, a medical office housed on the grounds of a school. They're open to serving students and their families, school staff, and many also see members of the community. School-based health centers are not a brand new concept. According to the Ohio School-Based Health Alliance, the first one opened in the state in 1995. But in recent years, under the leadership of Governor Mike DeWine, the state has jumped into this space with both feet and supported the addition and expansion of many more centers. The Ohio School-Based Health Alliance now lists 138 centers operating in Ohio. The Ohio Department of Health is just one state entity that has supported these centers. The Department of Behavioral Health, the Department of Education and Workforce, the Department of Medicaid, and the Department of Development through the Governor's Appalachian Children's Health Initiative have also played key roles in this effort. The Ohio Department of Health began supporting school-based health centers in 2022, initially using federal COVID-19 relief funding. With this generous support and then further generous support from our own General Assembly, we've continued to be able to support these centers with $15 million in general revenue funding in the last budget, that was fiscal year 2024 to 2025, which has increased to $20 million in the most recent state budget passed in July for fiscal years 26 and 27. With that funding from our legislature and previous funding, so far through the 2024-2025 school year, ODH has supported school-based health centers in 49 school districts in 27 counties. This major investment is because we recognize the importance of improving access to healthcare. Because they're housed in schools, medical care is now available in a trusted and familiar community setting, a place where students, families, and the community already gather. This can help overcome many of the barriers that we know sometimes prevent people from seeking care, such as a lack of reliable transportation, the challenges of a parent or guardian taking time off work to take a student to an appointment, or simply an inadequate number of providers in a particular area. Research has shown that school-based health centers not only can improve students' health, but also support academic success. Data that we've recently begun gathering from several of our ODH-supported centers shows that kids miss less class time, gaining about 3 hours of additional instruction time compared with leaving school for care.
Ohio Health Director Dr. Bruce Vanderhoff discussing the importance of student health centers. I'm London Mitchell. We are staying in contact. Joining Dr. Vanderhoff at his recent news conference to discuss the concept of student health services was Senior Director of School-Based Health Service at Nationwide Children's, Dr. Mary K. Irwin, along with Dr. Sarah Bodie, Medical Director of School-Based Health Services at Nationwide Children's Hospital.
School-based health centers generally operate with flexible scheduling. So certainly appointments are made, and we have appointments for preventive visits, such as for well visits and vaccinations. But it's important to remain very flexible for children who may fall ill during the day. So unlike a traditional outpatient clinic setting, if you, say, for example, have a couple of children on the schedule for a well visit, and all of a sudden, unexpectedly, someone needs us immediately, we have the ability to move that well visit to the next day because we're going to be at school just like that student will be tomorrow, right? And so we very much want to be flexible, and most people in school health, are very flexible. That also includes accepting referrals from just about anybody. So, of course, parents, we have great relationships with our parents, and they can call in and make appointments for their children. Sometimes older high school students refer themselves and seek care on their own. And also teachers, school nurses, coaches, all refer students into a school-based health center. Very important to note, though, care is never delivered without parental involvement. So all care is consented care. And that can look a number of ways. First and foremost, parents are always welcome to attend an appointment at a school-based health center, but it's often not required. We're trying to reduce barriers. One of those barriers being that, mom or dad has to take off work to shepherd the child to the appointment. So in the event that mom or dad is unable to attend the appointment, that's okay. We make sure we have the consent for the appointment. And if mom wants to speak or phone in or FaceTime into the appointment, that's encouraged. Or if that's not an option, we may call her after work to tell her how the appointment went. Dr. Buddy, you want to talk about school nurses?
Yeah, so just a note on that parental consent. Obviously, we're talking to parents before, during, after, and like Mary Kay mentioned, the key to that is flexibility, because we know parents often have jobs where they may not be able to be talking at the time of the appointment, but they are absolutely involved in every aspect of their child's care. The school nurse is integral to the success of school-based health centers. School nurses are providing care for students day in and day out in the school setting, and they're often the eyes and ears that might know or identify issues that are coming on. So a child falls acutely ill during the school day, their first stop is to the school nurse, where they're doing their job, triaging that student, understanding what's going on. If they're determining that they would benefit from a doctor's appointment that day, then they're often communicating with the parent and with the clinic, and we're arranging that in real time for them to walk over. So this is really a great relationship back and forth, and the school nurses are invaluable to identifying the success of that. That can also include chronic diseases. They might be a student that's coming down to the nurse's office for abdominal pain over and over again, and we're trying to figure out what might be going on. So really an open door policy, as she mentioned, to ensure that we're getting everybody in, whatever their issue may be, and getting their needs met.
Now, back to Dr. Vanderhoff.
In addition to essential primary care services, I know that a number of school-based health centers are beginning to add services to their portfolio. Increased behavioral health support, dental services, and some vision services. Could you talk a little bit more about these services and that evolution?
Certainly. So school-based health centers generally start with comprehensive primary care. So the primary care sort of being the anchor, of the service. And then oftentimes are looking toward how to address mental health. And that can look at a number of different ways relative to therapists that are there in the school, telepsychiatry services, primary care providers who are trained in primary care mental health. And you're right, we're seeing an expansion of dental care, and not just sealants. We're seeing, people being able to do both a preventive and restorative care, even x-rays in school settings. Vision care we're seeing as not just a vision screen, but rather connection to glasses and even glasses repair. Also, collaborations with specialty care. So for children who are having a hard time, following up on, say, frequent lab draws, how can the school-based health center collaborate with specialists to do some of those in between appointments. So lots of exciting things coming relative to the expansion of scope of care that's delivered in a school-based setting. But what I would say is really important in school health is, regardless of the type of care that we are offering in a school-based health center, it's really important that it's comprehensive. So generally speaking, these school-based health centers are located in places where individuals are disconnected from care or have a hard time with follow-up. So for example, you don't want to be doing, well visits at the school, but then say, gosh, I wish I could give you your vaccines due today, but I can't. You're going to have to go somewhere else. So it's important, that it is comprehensive. So again, regardless of the type of care, you tend to see successful school-based health centers being comprehensive. So for example, again, not just a vision screen, but a way to get glasses, right? So they're comprehensive, and then they're also linked to 24/7 care. So you want to make sure that the patients who are seen in a school-based health center, if they have a problem on a Saturday or a Sunday or over summer break, that those patients know exactly where to go, so that the care that they have access to is comprehensive and safe and year-round.
There are currently 6 communities in Ohio with student health centers. We've been listening to the excerpts from a news conference this past week, hosted by Ohio Health Director Dr. Bruce Vanderhoff. And that's our program for this week. I'm London Mitchell. Please accept this invitation to join us again next week as we continue staying in contact.